TIMI-61 study studied a drug called lorcaserin, which is a weight loss agent. It's approved for use in the U.S. And the question really was, it's been shown in the past to be an effective weight loss agent. And the question was, is it safe from a cardiovascular perspective? The history with these weight loss agents is that several have been shown either to cause cardiovascular harm or psychiatric harm. And so the question was, can we find a safe agent that promotes weight loss? Ultimately, we did. And so lorcaserin did, in fact, result in more weight loss in the 12,000 patients that we studied over about 3.5 years. And it was safe from a cardiovascular perspective, so it did not increase the risk of heart attack, stroke, cardiovascular death. And really, this is the first time that any weight loss agent has been able to show that. When we looked obviously at weight loss. We saw there was significant weight loss, and in that setting there was some improvement in cardiovascular risk factors. So as I said, we saw a reduction in new onset diabetes. We did also see an improvement in glycemic control, an improvement that was small but significant in blood pressure and heart rate, and even lipid control like triglycerides. And so the question was, in that setting, is it not only safe from a cardiovascular perspective, but could it potentially offer benefit? And so what we looked at was safety, which was cardiovascular death, MI, and stroke, and it was completely safe there. But then we looked for efficacy, and that was for a broader endpoint of cardiovascular death, MI, stroke, but then also heart failure, unstable angina, and coronary revascularization. And ultimately, there was not any significant benefit. It was safe, but not effective at preventing those events. All of those individual things that I mentioned, they all really had a point estimate around 1, meaning that there was no difference between the treatments. And why there wasn't benefit is hard to say. Because you would expect that if you overall sort of improve somebody's cardiometabolic health, that you might have benefits. It may be that the benefits that we saw, the reductions, were sort of modest in terms of those risk factors, or the amount of time that we followed patients for. 3.5 years. It is a long time, but it may not be long enough to see those effects. Another potential explanation is just that, in fact, weight loss doesn't reduce the risk of any of these endpoints, which I find hard to believe intuitively, but honestly, it's been very difficult to show in other studies as well.